Let's bring in Senator Gary Peters. We have so many things to talk to you about today, but since we're just coming out of the media briefing, your thoughts on the announcement of the pause on the Johnson & Johnson vaccine?
Well, it's certainly something that they need to do. There has been some cases of blood clotting, and so certainly you've got to err on the side of caution, so it's the right thing to do. Hopefully it can be investigated quickly, and hopefully they can find out what the answer is as to whether or not we can continue to use the Johnson & Johnson. But in the meantime, it's important to stress that we have two great vaccines, one from Moderna, one from Pfizer, that's actually made right here in the state of Michigan. Those are safe, they're effective, and folks need to get out and get those vaccines as quickly as possible.
Senator, I expect you're going to be getting a lot of calls from residents here in the state of Michigan with concerns over this development. How do you think this is going to impact the overall effort here in the state of Michigan to try to get as many people vaccinated, because our numbers are surging right now?
The numbers are surging, and it certainly is a concern. I had a call yesterday with CEOs from all the leading hospitals all across the state. They are very concerned. They're seeing folks come into their hospital at levels that they haven't seen in a long time. In fact, in some ways higher than what we've seen earlier. So it's stressing their staff that is already tired after repeated surges. So it's a real challenge for them. What they're telling me is that they are seeing the age come down to their average patient. In fact, I think depending on the hospital, it was somewhere around 56 or 57 years old. That's considerably less than what they saw in previous surges, which were in the high 60s. And I asked them specifically, is that because we're seeing higher vaccination rates with folks who are older than that? And they said most definitely, because others have been vaccinated. You are now seeing the virus hit those folks who were not vaccinated. That age is coming down, but they're concerned deeply about that, which makes it incumbent on us to do what we know actually works to slow down the spread of this virus. And that means wear a mask, social distancing, make sure you're not congregating in groups. We need to do that immediately while the vaccine continues, both the Pfizer and Moderna vaccine continue to be put into people's arms.
So if I can kind of ask you just your thoughts, we had the CDC, which basically is saying they're not going to play whack-a-mole with the vaccines and trying to surge vaccines in some of these hot spots, which the governor has requested. Your thoughts on that process, and also, not shutting down things more here in the state of Michigan?
Well, I think it's it's important to make sure the vaccines are available to those places that are actually using it. I had this issue and I fought aggressively at the beginning of this pandemic when we know that the Detroit area was a hot spot right from the beginning. I serve now as chair. I was ranking member at the time of the Homeland Security Committee, which oversees FEMA, responsible for the distribution at that time of the personal protection equipment. And they had the similar kind of process. They were putting it out equitably, equally across the country, which I understand. But at that time, we had a shortage of personal protection equipment, and yet we had surges in areas like Detroit area that were critically short. And we worked aggressively to try to get some of that personal protection equipment into the hotspots. It's basically a triage situation. Make sure supplies are available to those in the greatest need, and then you backfill other places. I think there's some way they can do that. And I've actually stressed this to the White House that I know there are a number of states in terms of the vaccine where their distribution has not been as aggressive as we have here in Michigan. And they're sitting on larger supplies of the vaccine. So that doesn't mean that we play whack-a-mole. It means that those areas where the vaccine is most needed, and if there are more limited supplies, make sure they have the supplies necessary to get it into the arms of their population. And certainly those states that may be sitting on larger supplies, they can wait a week or two to get additional, because it's not going to put them in any jeopardy. We don't want to put another state in jeopardy while we're taking care of Michigan. But I think there's a way to manage that in a way to make sure that those areas where they're seeing a surge, that the vaccine gets out. But I also want to reiterate, and I think probably I didn't hear the CDC briefing that you just had, if it just dealt with Johnson & Johnson, but the CDC has also put out a notice to realize vaccines do take a few weeks to work. Once you get it in your arm, it's still a 2+ week process before it really starts having an impact. And that means it's incumbent on each and every one of us individually. The way to stop the disease from spreading now is to wear a mask. It's to stay socially distanced. It's to wash your hands. It's to stay away from groups that may spread it. So we can take action now, and we must take action now while we continue to make sure the vaccine gets into as many arms as possible, as quickly as possible.
Well, we know a lot more about this virus than we did a year ago. But back in the beginning, a lot of the shutdowns were due to try and flatten the curve, to try to keep our healthcare systems from becoming overwhelmed. But right now, they are overwhelmed. So why not be shutting things down? I think there's just a mixed message in there to the public right now.
Well, that's ultimately going to be the governor's decision based on the advice that she's getting from epidemiologists here at the state. But I think she has already announced that there's a pause on reopening businesses. She's asked for a 2-week pause from school districts and others. So she has been certainly putting that information that we should take a pause on these kinds of reopenings.
So if I can ask you, things are a lot different than a year ago, and as you were mentioning, we were in such short supply of PPE back in the beginning, and a lot of it was because we weren't manufacturing so many of these items here in the United States. I know you've been an advocate to try to bring manufacturing back to the United States and to the state of Michigan. Do you want to talk more about that?
Well, I have been working on that. We're going to continue to work on that to make sure that these critical supplies are made in the United States and in Michigan. We have a unique opportunity to do that because of our manufacturing expertise. But you mentioned the report. Actually, as the ranking member of Homeland Security, I had my committee do a report in 2019, before the pandemic, looking at critical drug shortages that we see at that time, even in this country, and shortages of medical equipment. And in that report, it was pretty clear that our supply chain is overly dependent on foreign sources. And when it comes to critical precursors for drugs that we use for every drug we use, the precursors are predominantly made in China. And the report conclusion that came out, that I put out, said that when there is a pandemic in this country, we're going to find ourselves in a very precarious situation. Little did I know at that time, just a few short months after that report came out, we found ourselves in a pandemic, and we found ourselves in the precarious situation that we had identified. And in that report, realized that we had to bring supplies back. We have to strengthen our supply chain. Now it's incumbent on us to do that. And clearly, no one's going to disagree with the conclusion that I had in that report now that we have experienced that. So we need to incentivize production here in this country, bring it back. I've got legislation to do that we're going to be pushing forward to strengthen those supply chains. Well, we know that supply chains, and this occurs not just in critical supplies like medicine. We're seeing that firsthand with the silicon chips that are used in electronics applications. It's having an impact on our auto industry because so many of those chips, and we're overly dependent, once again, on foreign manufacturers for chips. And as a result of those shortages, we've got auto plants shutting down and people being laid off because of it. We have to make more resilience in these supply chains, bring this more onshore. There has to be a focus on that. I'm also working on a National Institute of Manufacturing to make sure that we put a focus on making things in this country. If you look at other countries around the world, they get it. They understand how important manufacturing is to their economies. I think of two countries in particular that do a good job at this, which is Germany and South Korea. We need to pick up from that kind of best practice and understand as a country, we need to also make sure we're doing everything we can to encourage, develop, and expand and strengthen manufacturing in America.
We're talking with Senator Gary Peters with us here on the MegaCast. If I can go ahead and jump around a little bit, President Joe Biden has been out pushing his $2 trillion American Jobs Plan, which started talk around infrastructure. Your thoughts?
There's no question that we have to make substantial investments in the infrastructure. Once again, you can't be a great country if you don't have world-class infrastructure. That means certainly the traditional infrastructure that we think of, which is roads and bridges, but it's also all types of infrastructure, from underground infrastructure when it comes to sewer and water systems. Certainly we know the importance of that from what happened in Flint. We also have to look at the infrastructure in terms of the internet to make sure that everybody has access to high-speed internet. It's a critical piece of infrastructure, and we saw the glaring gaps in that through this pandemic, where children who were not being in school and had to be instructed online, we found at the beginning of this pandemic, 1/3 of our students did not have the connectivity necessary to do their schoolwork via online. Some of the powerful tools to deal with the delivery of healthcare, particularly in a pandemic, which is telemedicine, where you can have access to medical services in the comfort of your home, but you need to have high-speed internet. Most folks are not able to take advantage of that, particularly the elderly who would most benefit from it. We have to look at high-speed internet the way in the previous century, we looked at electricity. We said that everybody in this country has access to electricity no matter where you live. The same thing with high-speed internet, big part of the infrastructure package. And when you're talking about electricity, we know that our electrical grid also needs to be updated and major investments need to be made. And anybody who has any questions about that just needs to look at what happened in Texas earlier this year, that we need to make those kinds of infrastructure investments. These are investments that need to be made now, and they will pay dividends to us for decades to come. And it's a necessary thing that has to be done quickly.
Yeah, I thought a lot about the electrical grid because we're seeing such a push right now for electric vehicles. And I know part of this plan does call for more charging stations throughout the country. But the grid can be, what year was that, 2006, 7?
Yes.
When we had the big blackout. And we see how sensitive the grid can be. And if we get more and more electrical vehicles on the roadways, we need it to be upgraded.
No question about it. You need to have, once again, that resiliency. Same thing as we talked about in the supply chain. You need to be resilient and thinking about it broadly. I passed legislation, for example, last year dealing with actually space weather events that can have an impact on the grid. You know, people don't usually think about that when you're thinking about resiliency, but that's that kind of comprehensive approach that we need. But part of that means making the investments to make sure that you have the security of that supply. And when it comes to electric vehicles, we know that our domestic manufacturers, GM, Ford, Chrysler, are all leading very heavily into electrifying their fleet. You're seeing more of those vehicles come out. Another area that I'm working on, which deals with automation and the ability for cars to be able to drive themselves, self-driving cars is the future of mobility, and our automakers are leaning in aggressively. But even before you get to that point, a lot of the technology that goes into that into self-driving will make our cars a whole lot safer than they are right now. They will eliminate a lot of the human error. In fact, if you look at accidents, 90+% of accidents are human error. You can eliminate a great deal of that. And when you think about the fact that nearly 40,000 people die in our country every year with auto accidents, this will save literally tens of thousands of lives. And if you ask the engineers at General Motors and Ford and Chrysler and other automakers, they will tell you these new safety systems, the ideal power plant is electric. And so they look at electrification as the future, not just as a result from a climate issue, but also as a safety issue that will literally save tens of thousands of people's lives each and every year on the highways.
So I'm wondering, where is the workforce going to come from? Because this is going to create a lot of jobs, but so many manufacturing plants right now are struggling to get skilled tradespeople to come work for them.
And that's actually part of the infrastructure package proposed by President Biden as well, is to expand apprenticeship programs, expand career training, skills training. We underinvest in this country in that kind of training, which is absolutely critical for our future. And if you look at what we spend on four-year college programs at the federal level, it's considerably more, by many multiples, of what we spend in skills training for folks, even though a majority of our population in our country are going to be in skilled jobs as opposed to going to college. And we have to continue to make those investments. I passed legislation last year, for example, to expand the ability for veterans coming off of active duty to be able to use their GI Bill in apprenticeship programs, not just 4-year programs, 2-year programs, but go into apprenticeship programs, have a wide range of opportunities to go into those skilled jobs, which many veterans want to do and are exceptionally qualified right out of the box to be able to go into those professions and contribute to the country while providing a very good living for their families. So those are the kinds of investments that also need to be made as we look to the future and make sure that we're aligning the skills that are available for folks with the jobs that are available.
Senator Gary Peters with us here on the MegaCast. We know that you have another meeting, so we want to say thank you for squeezing us into your schedule. We appreciate your time and we appreciate your leadership throughout this pandemic.
Well, great to be with you. Thanks for having me on, and I'll look forward to being on again if you have me in the near future.
Anytime. You're always welcome.
Thank you.